My name's Tara Crockett. I'm with Medical Simulation Corporation. I'm from Denver. I'm here helping Swedish Seattle Science Foundation to conduct these stroke process runs. Our goal is to focus on the early identification of the acute ischemic stroke, getting them to the therapies that they need as quick as possible. So where can we cut down time? How can we identify them faster? So while we're doing these particular processes, I want you to be thinking about how things are working in your facility. So we're going to be doing some new and improved things that they're testing out here as well. So they have a great process right now, and they're refining. And where are we going to go? How can we do it faster, better, quicker for improved functional outcomes? So we have a great team that's collaborating, and they're being actors for the day, so a little bit out of their comfort zone. We'll be doing a couple of different stations. We're having AMR participate, so they're going to do a quick pre-hospital. They're going to go ahead and call in a stroke alert. We're going to have that handoff. We're going to go to CT. We're going to go to the emergency department room. We're going to go to the IR suite. The whole point is to get people from different campuses together so that we can streamline things. All right, we're going to start.
What was your name? Scott, I'm dealing with AMR. What's going on today?
Arm.
Your arm?
Yeah.
Having trouble speaking?
Yeah.
Okay. All right, do you want to get some vitals real quick?
Sure.
Are you related to him?
Just a coworker.
What was your name?
Gabe.
Gabe, were you here when this happened?
Yeah, so we were just eating breakfast and he just started acting like this and just decided to call 911.
Okay. When's the last time you saw him normal?
About 30 minutes ago.
30 minutes ago? Okay. About 10:20.
So blood pressure is 190 over 100, pulse rate of 68, respirations of 18.
Okay. All right, I'm gonna have you hold your arms out for me. When palms up, close your eyes. I'm gonna have you hold your hands just like that. Okay, hold them up, hold them up, hold them up, hold them up. Okay, good, go and relax. Open your eyes. And go and smile for me with your teeth. Big smile. Perfect, all right. Can you repeat a phrase for me? Can you say, it's always sunny in Seattle?
Oh, that's science. Yeah.
Okay, all right. Does he have any medical history that you know of?
High blood pressure.
High blood pressure?
Yeah.
Okay. Did you take that pill this morning? Not sure? Okay. Okay. Well, we're going to do, are you able to come to the hospital with us?
Sure.
Okay. We're going to need to get you to the emergency department, have you evaluated. Okay. You are showing some signs of stroke that we're a little bit concerned about, so we're going to get there quickly and safely. Okay? All right. Calling the ER.
Emergency department, this is Ron, I'm in charge.
Hi, this is Billy with AMR. I have a BLS patient for you.
Okay, go ahead.
All right, we're seeing a 52-year-old male coming from a home showing signs of CVA, this time with onset approximately 30 minutes ago, calling it 10:20 this morning with a friend as witness who will be with us. He's exhibiting right-sided weakness and slurred speech that happened while he was eating breakfast today. He does have history of high blood pressure. We are finding him hypertensive at this time at 190 over 100. Heart rate is regular at 68, breathing fine on room air, about 18 per minute. We do have a blood sugar of 122 on scene. We're about 5 minutes out. Any questions?
Yes, contact. Do you have a phone number for contact, please?
We don't. He's actually with us and will be coming with us to the ER.
Okay, can you give me a quick number for that person? Because I'd like to let Neuro know.
Sure. It's 206-555-1212.
Okay, great. We will meet you in the bay in 5 minutes. Dr. Smith, we have a 52-year-old patient coming in, last known normal 30 minutes ago. He has right facial droop and slurred speech, positive fast. EMS is bringing him in. They do have an IV line established. Blood pressure is 190 over 100, heart rate 68, respiratory rate 16, blood sugar is 122, and there is somebody with him that witnessed this, and I'm going to call neurology and give them a heads up.
Okay,
So we'll let you know. We'll meet him in the ambulance bay in probably 4 minutes. Tricia, if you can please be primary. Sure. You be secondary backup.
Sure.
Did you hear the short, or do you want me to?
No, I heard you.
Okay.
Thank you.
Great.
Guys.
This is Scott. Scott's 52 years
Hi,
old.
Scott.
At about 10:20 this morning, he had a sudden onset of right-sided weakness and slurred speech. His friend here, Gabe, was witness to that. He was just eating breakfast at the time it happened. History of hypertension. We are finding him hypertensive now at 190 systolic. Heart rate's good, around 68. Sugar on scene was 122.
Great.
Thank you.
Thank you.
Scott, my name is Tricia. I'm one of the nurses here.
Hi, Scott. My name is Dr. Smith. I'm one of the ER providers here. How are you doing?
Good.
Okay. Scott, you're showing signs of a stroke, so just to let you know, we're going to do a rapid assessment of you. We're going to be moving very quickly. Do you have any major medical problems?
High blood
Okay.
pressure.
High blood pressure. Have you ever had a stroke before?
No.
No. And do you have any kidney or liver problems?
No.
Okay. Do you take any blood thinners?
No.
No. Okay. And do you have any allergies to any medicines or iodine dye? Have you ever had a CAT scan
No.
before where they give you iodine?
No.
Okay, great. So I'm going to do a rapid exam on you. Can you look over here at me? Follow my finger. Look over here. And look over here. Good. Look at my nose here. Can you use this hand to point when you see my fingers wiggling? Good. Can you smile for me? Good. Can you hold this arm up? Hold it up. Good. Go ahead and put it down. How about this arm? Can you hold it up?
Yeah.
Okay. Can you wiggle these toes for me? Okay. How about these toes? Can you wiggle them? Okay, great. So, Scott, we're going to get you to our CT scanner very quickly here, okay?
Okay.
Can someone have the ED Huck activate a code stroke? I'll go ahead and put in an order for CT and CTA, and I'm going to call pharmacy to premix TVA.
Got it. Okay.
I'll let CT know you're on your way.
And Scott, we're going to take you to CT to do a scan of your head, okay?
Okay.
Thanks, Dr. Smith. So we're going to go head first. So we're going to slide you over to this table, Scott.
I'm going to lay you down flat, okay?
So with you, we do everything in a hurry here because it's an emergency and we're kind of going fast. Don't be afraid. You're going to turn towards me and you can't fall. There's two of us right here, okay? Okay.
Good call.
Okay. Yes? Okay. Oh, we're not going to slip.
3, 1, 2, 3.
Okay. Can you be a little slippery on that? So I'm going to grab some gloves. Okay. Wait a minute, I'm not going to help you. Just sit down. All right, you got him?
Yep, we got him. So Scott, can you tell me your first and last name?
You want to do one line on that side? I'll do one line over here.
Okay, and when'd you do it first?
We're going to do it prior to the,
Do you have
a bell time?
Do we have a line in?
We're getting it right now?
Perfect.
What's your name? We're going to do it. What's your birth? Okay, when were you born?
October 22nd.
True. That is correct. So there's going to be a tourniquet on each arm that's going to be tight, okay? We're going to put some IVs in here. Okay. You're going to feel a poke. 1, 2, 3. Okay. Scott, the reason I'm just asking you your name and date of birth is just for your safety, okay?
Okay. So I have an 18 gauge in the right AC. So it would be good for your CTA and your CTP.
Scott, any allergies to
I'm gonna go ahead and run the point of care at Chem 8 and send the CBC and the coags to lab.
Okay.
Just keep your head nice and still for me. Perfect. Try to hold still. Keep your hand down. Can you put your arm back down?
Yeah.
Yep, let's keep your hand down. Hold still. Don't move. You're doing good. Scanning. And we're done.
All right. Alyssa, can you grab our stuff?
Yes, I will.
Okay,
Do we have our glucose?
I think they're.
So our glucose is 110 and a creatinine of 1.3.
Okay, perfect. Well, Dr. Ho from neurology is here.
Hi everyone, neurology.
This is
Hi.
Scott. He's a 52-year-old gentleman who presents with a last known normal about 30 minutes ago. And he has right hemiparesis with a right facial droop, right arm and right leg weakness, and slurred speech. I haven't really honed in on the exact last known normal, but this is what I was told from EMS. He's got a history of high blood pressure, no kidney or liver problems, no other major medical problems, and he's not on any blood thinners.
Okay, well, let me look at the head CT.
Glucose
Glucose
is
is 105. 105, yeah,
Okay, and the other thing is, a few weeks ago, he had a side to this, the friend doesn't know much more about it. It's self-resolved, and he just wasn't feeling well this morning, but it wasn't acute onset.
You need some help on that side. Yes, we do. Sounds like that was a TIA.
Yes.
All right, Bronwyn, you want to help slide?
Absolutely.
Are we using
Where's the,
The sheet's under there.
It's
so I
under
think
there.
this,
We'll take the
are we
white.
taking the whole thing?
Yeah.
The white
Okay.
sheets, yep.
On
On
three?
On three. 1, 2, 3.
Good.
Okay, thanks, everybody.
You guys in what room?
2, right?
Are you going over that?
Yep. Yeah, I'll get your head up here in a minute. Hi, Scott. My name is Dr. Ho. I'm a neurologist. We're concerned that you're having a stroke. You want to get an EKG? I'm going to examine you. Let's get some vital signs. Thank you. I'm going to put this on your finger and get a blood pressure on you, okay? You with us? Okay. This is going to be tight on your arm, okay? It looks like on telemetry he's in normal sinus rhythm. Yep. Getting a blood pressure. We have a SATA 91. I'll go ahead and put him on 2 liters of nasal cannula. Okay. It looks like his blood pressure is quite high. I see a systolic of 199 and a diastolic of 90. Let's get labetalol going. Okay. 10 milligrams. You got it. Labetalol 10. Turn your head this way a tiny bit for me. Thank you. Okay. Get that for you. Sure. Okay. So just labetalol for me, 10 milligrams. Arm down. So I'm seeing a facial droop. Okay.
You got the EKG.
Pupils are equal. This arm feels quite flaccid. We'll do a formal Nih Stroke Scale, but I'm worried if this is a big stroke. I think that we should call pharmacy, and I think we should mix TPA. Okay. You have to call as the physician. Will you give them a call? Thank you. Hi, pharmacy. This is Dr. Ho from neurology. I have an acute stroke case here. I'm going to order TPA on the patient, and we'll be in room 2. Thank you. So 10 milligrams IV labetalol in. It's flushed.
Okay. Trish, I got a weight in CT of
118 kilos.
118 kilos.
Yes,
I'll put that in the computer for the pharmacy.
Great. So shall we run the Nih Stroke Scale? That sounds good. Ready?
Here we
Can
are.
you help me score it, Yasha? Yep. Okay.
Here we go.
Sure. Great.
I'll wait.
Scott, can you tell me your last name?
Oh,
Okay, good. And what's your age?
52.
Okay, so he's alert. He's answering both questions correctly. Got it. Scott, can you raise your left hand? Good. And can you stick out your tongue? Great. So he's doing both commands. Okay. All right, Scott, can you look to the right? And then look to the left. Look up. And look down. He scores well on the gaze. So normal gaze? Normal gaze. Okay. So I want to test your vision. I'm going to stand right here and I want you to look at my nose. I'm going to wiggle fingers, and if you can point with your hand where you see movement.
Okay.
All right? So look right here.
Okay.
Good. Good.
Both.
Both? Okay. Look here again.
From here.
Great.
There.
Mm-hmm.
Both.
Okay, great. So 0 for visual? 0, scored perfectly on the visual fields. I see that he's got partial paresis, so he scores a 2 on the facial droop. All right, let's hold this arm up, and we'll count to 10. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, you can relax that hand. Can you lift this hand at all? Okay, it's barely against gravity, so there's some movement, so I'm going to score it a 3. Okay. All right, let's do this leg. Can you lift this leg up? And we're going to count to 5. Ready? 1, 2, 3, 4, 5. Good. You can let that leg relax. Let's do this side. Can you lift this leg up? Okay, there's some movement, but it's not against gravity. So that's 3 on the
Dr. Ho,
right
the
arm and
blood
right leg.
pressure is elevated. Do you think we should?
Yes,
more
so
labetalol?
let's see. We should give a second dose of labetalol. Let's give 20 milligrams.
20 milligrams?
Yes.
Okay. Perfect.
And I think because we're giving a second dose, we should get that cardipine drip ready in case we need it. All right. I'm going to have you, I'm going to remove this. I'm going to have you take this finger right here and touch my
Should be in a
finger.
minute. Okay.
Use that same finger and touch your own nose.
Uh,
Yes, there you go. Okay, and then touch my finger. Good, touch your nose. Great. Okay, so no ataxia on the left. Okay. Let's take this leg right here. Do you feel me touching you on the heel? I'm going to have you take that heel and touch it to the kneecap, and then bring it down to the ankle if you can. Good. That's good. So no ataxia on the left leg. Now I'm going to test how you can feel. I'm going to touch your face, and you can tell me
Dr.
if
Ho,
you're
can I ask you a
feeling-
question?
Sure.
I'm sorry. So because he can't move the right side for ataxia, does that score against him, or no, it's a 0 because his left side is
Well, we're unable
nice
to test
and fluid?
it. Yes, so it's 0 on the left because he can test, but we're unable to test this side because it's so plegic.
Okay, gotcha. Thank you.
Let me test your face. You tell me if you can feel the sensation.
Okay.
All right?
Yeah. No.
It feels dull? Okay,
Dull.
so there's lots of sensation on the right. I'm going to do both sides. Can you feel both sides? Okay, he can feel both sides. Now I'm going to test the arm
I'm going to
here.
give 20 milligrams
Okay, go
of
ahead.
labetalol. Scott, I'm giving you some medication for your blood pressure.
So for number 8
What
sensory
your
loss,
name
he
is?
was.
I'm still doing it. Let me
Okay, I'm
finish.
sorry.
And your date of birth?
I told you already.
Yes, it's just for your safety. I'm double checking.
October 22nd, 1960.
Okay, thank you. Thank you,
Okay,
doctor.
all right. I'm going to test your legs first since we're working on your arm there. Can you feel me touching your foot?
A little.
A little, okay. How about this side? More on this
Yeah.
side? How about both sides? You can feel both?
It's more left.
Okay, all right. So there's decreased sensation again on the right side.
Labetalol, 20 milligrams IV push given.
Great, thank you. All right, let's test your arms. Okay.
Yeah.
Thank you. Thank you.
Oh.
Okay, done.
This is here.
Okay, so for sensation, he's got a dense loss, scores of 2 on sensation. All right, let's test how you can. I see that he has dysarthria. It's quite dysarthric. I'm going to call it a 2 on dysarthria. Okay. And then I'm going to have you look here at these pictures, and I'm going to point to a couple pictures. What do you see here?
Chair.
Chair. Okay, that's great. How about this one? Great. How about this?
Glove.
Great. Now I'm going to give you some words to read. Can you read that phrase?
You know how.
Uh-huh.
Down to earth.
Good.
I got home for work.
Okay, good. So he actually scores really well on aphasia. All right. Okay.
So what's his total score?
And then he gets he gets no points for neglect.
Okay, so we're at a 14 right now?
Yes.
Okay.
Okay.
And Dr. Ho, do you want to do the exclusion criteria, or do you want me to?
Yes. Let's do a safety pause. I think let's check another blood pressure.
166 over 86.
That's good for TPA.
Our
That's
stats are up on the 2 liters.
Okay. So, Scott, I'm going to ask you some questions. Have you had any surgery in the last 14 days?
No.
Okay. Are you on any blood thinners?
No.
Okay. Have you had any bleeding inside your belly or in your urine?
No.
Have you ever had a brain bleed?
No.
Okay. So I want to talk to you about giving you a medicine. The name of the medicine is called Alteplase. We're worried that you have a stroke and that this stroke is caused by a blood clot that's sitting in the blood vessel of your brain.
No.
This is causing you a lot of disability, and we want to help improve that disability. So this medicine is a clot busting medicine. It's time sensitive. We have to give it as quickly as we can.
Okay.
I think that the benefits of this medicine outweigh the risks. What are the risks? The risks are that it can cause bleeding internally inside your body. That's why I'm asking you about bleeding inside your body. And bleeding in the brain, and we think about 5 to 6% of people will have bleeding in the brain.
Okay.
It is a complication of this medicine, but I feel that the benefits of the medicine are outweighed by the risks.
Okay.
If you're okay with this, I'd like to proceed and give you this medicine.
Okay.
Okay.
His EKG looks good. I don't see any
Okay.
ST elevation.
So let's look at the labs. His platelets are 315. That's okay. Let's look at coags. The INR is 1.0. Other coags are fine. He's not on the blood thinner. And the creatinine is 1.3. Okay.
Scott, we have your friend here too, so he was
Hey,
listening
buddy.
to all
How are
that,
ya?
okay?
Hi.
Hi.
Hi. How are you?
Good, Gabe.
Hi,
All right,
Gabe.
so-
I'm Dr. Ho from neurology.
Nice to meet you.
So are we confirmed that yes, we're gonna go ahead and give
Yes.
out the place?
Yes,
Okay.
we are. We have room to go.
She and I checked it.
Gabe, we think this guy's having a stroke, and we're giving him an emergency stroke medicine
I'll
called
go run to his arm
Antivirus.
down.
Okay, perfect.
Everyone, I think what I'm going to do next is I'm going to call interventional radiology. I'm worried that this is a big stroke. I'd like to see if the CT angiogram, oh, there it is. The CT angiogram shows that there's a left MCA stroke. There's a clot sitting in the MCA. So I think I'd like to call Dr. Yinslow and activate a code IR.
Great. Okay,
We're
so
now should go for TBA.
Yes.
Yes, for
to
TBA.
go.
Lisa, I have
Yes.
Scott Bartholomew. Date of birth is 10/22/63.
Okay, good. And I have, as we checked, 9
9
milligrams of TPA.
So it looks like also that the CT perfusion has now been processed, and it looks like there's a core that's small compared to the penumbra that's in the green. It's quite large. So I think there's a big mismatch. So I'm going to call Dr. Lowe.
Alteplase 9 milligrams, IV push given.
Hi, Jens. This is Emily Ho from neurology. I'm here in
together.
room 2 in the emergency department,
for you, okay?
and I think that there's a
And we're gonna
good
keep a really
candidate
close
for
eye
IR
That's normal.
thrombectomy. It's a left
We're
M1
concerned.
occlusion. The
You're good.
CT perfusion shows a large mismatch, and I think that he would be a good candidate. Does not take
So let's
does
cycle
not
the
take any blood
pressure.
thinners. He's getting TPA right now. He's within the TPA and the IR window. Are you
doing
won't be
okay?
having TPA running imminently.
Okay.
So do you want this spiked? Do you want the nicardipine spiked and ready?
Let's see. Yes.
Okay.
And while we are running TPA, let's check the blood pressure a couple times.
Yep, we're trying.
Q5. Every 5.
Hey, Emily.
Hi, Jens.
170/89 is the last blood pressure.
So this is Scott Bartholomew. He's here with right hemiparesis, and Nih Stroke Scale is 14, and his last known normal,
Was 10:20 a.m.
yes,
Which
witnessed
other
by his
120?
friend here, Gabe.
What are we thinking his syndrome is?
So it looks like he has a left M1 occlusion.
Okay.
We see that on this CTA, and that's his perfusion scan.
All right, let's go look at his imaging.
Yes.
All right, so what do you think?
I think we should go. What's your name?
I agree.
This is definitely a disabling, and he's young.
Okay. What's his medical history?
He
History
has
of hypertension.
And it sounds like he had a TIA recently with a complete resolution of his previous symptoms.
And any cholesterol issues, AFib?
Not that we've heard, no, and he was sinus on his EKG.
And we don't suspect dissection.
Not that we know of. Scott, have you had any headache or neck pain recently?
No.
Okay.
He's
Sounds like not.
consentable. He's his
Yes,
aphasia
He's
is
alert
not-
and oriented.
Yeah.
Let me stay on this side.
Hi, Mr. Bartholomew. I'm Dr. Lowe.
Hi, Doc.
I'm the neurointerventionist. I work with Dr. Ho and the ER doctor,
Okay.
Dr. Smith, that
The
you
last
met.
pressure was
So,
65/80.
as you probably have been
Okay, great. I have not
informed, you're actively having a stroke right now. You have actually a fairly large clot that's blocking up one of the arteries that's controlling the entire left side of your brain, which is why the right side of your body is not working. You
Okay.
understand everything I'm telling you?
Yes, sir.
And I think that at this point, this blood clot dissolver that we've given you has a very small chance of working, but for how big your clot is, it may not open it completely. So we don't want to wait to see if it works. I think we should actually go in and try and take the clot out, because right now, it looks like you have a lot of reversible problems. So not all the stroke is permanent. Okay. If we leave it there over time, the stroke will develop into a permanent deficit. So what we want to do is prevent disability or even death, because this clot can actually cause a large enough stroke that can kill you. Understand? Okay, by removing the clot, there is a chance that we could cause damage, but most likely, by opening up the clot, that's the best way we can prevent any further ongoing stroke. In fact, a lot of the problems may reverse or improve significantly. Do you have your consent? And you fully understand everything I spoke to you about? Okay. Let's call a lab and let them know we're on our way down. And we're both agreeing we're a go.
All right, thanks.
Okay, so let's send out a page for proceed to IR.
Okay, I'll call code operator. Hi, operator. I'd like to activate an internal code IR. Patient's name is Scott Bartholomew, and he's going straight to IR. Thank you.
Yes, our recent blood pressure is good. Yeah, absolutely. Thanks.
Scott, we're going to go down the hallway.
Okay.
And we're going to meet some other people there. Okay? How you feeling?
Nervous.
Okay.
Scott, I'll see you after your procedure in the critical care unit.
Let us know how you're feeling. Tell us about any headache or any problem.
Okay.
And get on steer.
All right, let's
Hey,
do a
Julie.
safety pause at the door.
Okay.
Hi Scott, my name's Julie. I'm a nurse. I'm going to be helping Dr. Lowe today with your procedure. Can you tell me your name
Scott Bartholomew.
and your birthday, please?
10/22/63.
Okay, thank you. We're going to get you into the room here.
So Julie Scott's 52-year-old male that at 10:20 was having some breakfast and developed right-sided weakness and slurred speech, history of hypertension. EMS was called. He was with his friend and they brought him in. He got TPA at 10:55. He received a bolus and then he's got the infusion running now. He'll need his flush in about 20 minutes. That'll be done.
We gave 2 doses of labetalol, and we have a nicardipine drip hanging, but we have not started that infusion because his last blood pressure was 162/70.
Okay. Any medication allergies, Scott?
No.
Okay.
No.
Got it. All right, great.
Thank
Thank you so
you.
much, Scott. Take care. We'll see you after, okay?
Okay. You're going to do good. Thanks.
Scott, we're going to get you moved over onto the x-ray table.
Okay.
Okay, we're going to get your pants off, get your groin shaved, skin cleaned, cover you with a sterile blanket. Okay? We'll give you some IV medicine to keep you comfortable through all of this.
Okay, Stephanie, so let's get a setup for usual thrombectomy, and we have some TPA mixed up as well. Groin sheath, guiding catheter, microcatheter, microwire, and stent retriever, 6mm stent retriever.
Okay. This is our procedural safety pause. We have Scott Bartholomew. His date of birth is 10/22/63. His labs, his platelets are 315, INR is 1.0, creatinine 1.3. He's having cerebral angiogram, possible thrombectomy, IA, TPA.
Agreed. All right.
Okay, we're moving Scott onto the procedure table.
So we're going to simulate that he's already prepped and draped. So at this point, we're going to get access to the groin. All right, Mr. Bartholomew, you might feel a little pain here. I'm going to put a needle into your groin and put a catheter up. At this point, he's under monitored sedation. He's not fully asleep. I'm going to navigate a guiding catheter up into his neck, knowing that he has blockages in his left carotid artery. And from the left carotid artery, I'm going to do a run. So when I see that video of that first image. So I'm going to have we see the blockage in the left carotid artery, enter the middle cerebral artery. I'm going to have to take a catheter now, microcatheter, and go through our clot. So once I've established that my catheter is in the right place, I'm going to then remove my wire. I've passed my clot. I'm going to take my stent retriever, which is a device which I'm going to demonstrate here. So once that device is loaded under X-ray guidance, I can see the markers of the device, and I can see it advance into the brain. And here the actual video will show that some of the device is coming out. And I'm going to slowly deploy the device by unsheathing the microcatheter. That engages the clot, and I let it sit for about 5 minutes. And go ahead and play that run. And this is what I see on my live x-ray is by injecting contrast dye, I can see where the clot is, but I'm also getting temporary bypass across the clot. So I'm letting the brain have some blood flow temporarily. At the same time, I'm allowing it to engage into the catheter, into the device. So 5 minutes has gone by. And while I'm aspirating from my guiding catheter, I'm going to slowly bring the whole clot back into it. And in this situation, we've been able to engage and fully remove the clot. And go and show me that last run. And what I see on fluoroscopy afterwards, after I do my run, is that there's complete restoration of flow into the middle cerebral artery. So this will be considered a success. All right, sir, we're all done with removing the clot. We're going to go ahead and close the groin area, and we're going to take you up to the ICU.